WHO definition: how it ensures children's health worldwide. The World Health Organization is a sort of crucial branch of the United Nations which was introduced in 1948. It aims to ensure a secure and healthy world for all human beings. They focus on the diseases and outbreaks and indicate the alarming rise of cases to cope with the problem immediately. The human world shares a great history of epidemics that lead to massive numbers of deaths. To prevent such unpleasant incidents, the World Health Organization keeps an eye on outbreaks and takes necessary measures to warn the world about upcoming dangers. Moreover, they work to improve the quality of life by eliminating diseases from the world. If you want to know the role of WHO and how it affects children's development, you are at the right place. This guide explores the WHO definition of children raising and mental health. Why was the WHO established? It is an organization that began in 1948 to guide and work with international health policies. The main function of the World Health Organization is to develop deals and cooperate with other global health programs, set rules and norms, conduct research, and offer technical support. With the primary goal to provide health facilities, it has reached a point where it originally focuses on children's and women's health, like sanitation, nutrition, malaria, and tuberculosis. What does the WHO do? The basic purpose of the World Health Organization is to monitor and coordinate activities related to the health sector and address issues such as genetically modified food, drug use, tobacco, and climate change. The WHO holds the power to modify and change norms according to requirements that they find necessary, even they consider protection from ex-husband. Since 1977, this worldwide organization has successfully maintained a list of highly used medicines in different parts of the world. They suggest hospitals have essential stock. Similarly, they have prepared a list of diagnostic tests and ensure guidance on priority medical devices, for instance, ventilators, X-rays, and ultrasound machines. The World Health Organization has proven its importance by performing a crucial role in many health sectors, for instance, the child vaccination program. This program majorly contributed to eradicating smallpox, poliovirus, and severe respiratory syndrome. This organization has the authority to analyze situations and declare global health emergencies. It is evident through its multiple acts, as it did at the time of cholera, smallpox, and rising cases of poliovirus. WHO drafts the strategy for 5 years. In 2019, they analyzed the world's condition and figured out 3 priorities to focus on for the next 5 years, which include offering high-quality health coverage to 1 billion people. Make sure that another 1 billion people get to enjoy healthy standards of health and well-being. It includes protection against non-infectious diseases like cancer. Saving more than 1 billion people from health emergencies. The determined priorities of the World Health Organization are enrooted in the United Nations Sustainable Development Goals. WHO about children's struggle and maltreatment. When the WHO analyzed the condition of the world, they found out that there are a large number of people who are deprived of the necessities of life. It leads them to compel or push their children to work and feed the family. Over time, this struggle becomes a norm that poor children are powerless and helpless creatures. We can do anything with them. Anyhow, child abuse, as well as neglect, is considered as the deprivation right of children under 18. It also includes physical and emotional abuse, negligence, neglect, sexual abuse, and other exploitation which ultimately or potentially disturb the health of children. The development, dignity, and relationship also go hand in hand in the context of a relationship of responsibility. Consequences. Maltreatment, whether it is happening with a 5-year-old child or 15-year-old child, serves short and long-term physical and mental health results. In some cases, daughter struggled, while in others, the son. This includes head injuries, severe disability, and STIs such as HIV. Young girls can also face multiple issues, including unwanted pregnancy, gynecological disorders, etc. Overall, maltreatment and accusation affect the mentality of a child, which impacts his cognitive and academic performance, which ultimately leads to alcohol and drugs. Major problems. Ill treatment in children ultimately leads to stress and disruption in the early development of the brain. The extreme form of stress can disturb the nervous and immune systems. With increasing cases of maltreatment, children become at a high risk of physical, mental, and behavioral problems, such as obesity, depression, smoking, alcohol and drugs misuse, perpetrating and victim of violence. The continuous violence against children also contributes to inequalities in education. According to a survey, children who face maltreatment are as likely not to graduate. Apart from health, there are many other special and educational consequences of child labor, struggle, and maltreatment. It significantly has economic impacts such as mental health treatment, hospitalization costs, child welfare, etc. Risk factor. The World Health Organization has identified multiple risk factors for child maltreatment. All risk factors are not related to social or cultural contexts. Here is the list to understand potential causes. Child. It is crucial to remember that a child is no one to blame. He is a victim. The children who are generally subjected to maltreatment are lesbian, gay, transgender, or bisexual. Persistent crying and shows unwanted behavior. Having unidentified neurological disorder. Parents. Not all parents are the same. Some caregivers and many women care for their little ones, while others with exceptional traits have less tolerance and they never felt guilty. The parents who remain actively passive are likely to unfairly treat a child. Those who find it difficult to bond with a newborn. Have unrealistic expectations. Not nurturing and looking after the child. Lack of awareness of child development. Community and societal factors. Some societal and communal factors increase child maltreatment risk. It includes high unemployment level and poverty, easy availability of drugs, poor living standards with poor social, economic, and health policies. Prevention. There are always solutions to every problem. According to WHO, by taking these preventive measures, you can reduce child maltreatment. These preventive measures include: parents and guardians are directed to take sessions to prevent child maltreatment and support healthy development and nurturing. Adequate nurturing is generally delivered by nurses, trainers, and social workers. Norms and value approach, programmer to transform restrictive gender norms around child discipline. Implementation and enforcement. Laws are supposed to stop violence and punishment and provide protection to children against sexual abuse. WHO about mental health strengthening. It is a term used to refer to mental well-being that enables people to cope with the stress of life, learn and work well. Moreover, healthy mental health contributes to the community. Optimal mental health is a crucial component of mental well-being. That holds our collective as well as individual abilities to make decisions and shape the mental world. Mental health is not just about the absence of disorders, it exists and works in a complex method. It can potentially affect our body functioning and even control the flow of hormones. Determinants. There are multiple determinants that come together to undermine mental health. Anyhow, the vulnerable family member's history can contribute to aggravating or maintaining good mental health. No matter how old you are, the risk always lingers, but those that occur at developmental stages are detrimental. According to WHO, the mental health of individuals is greatly affected by class distribution, the economic downturns, and quality of education. For this purpose, it takes measures to prevail over inequality and eradicate social determinants. Promotion and prevention. This works by identifying the individual, social and structural determinants of mental health, which are later intervened to reduce the risk and build resilience. These interventions are designed for particular groups, people, and the entire population. Reshaping mental health demands actions beyond the health sector. Therefore, the promotional programs are expected to involve good school, education, labor, justice, etc. WHO about raising children. A healthy world is developed by good people and eliminating evil. It is only possible with optimal parenting. When excellent parent knows what to tell their kids and what to expect from them, they contribute to building a healthy society and live up to societal expectations like relative pronoun. Nurturing the baby in a healthy environment gives him positive energy to do something good and get better life. World Health Organization views. According to the World Health Organization, every aspect of being a parent is complicated. Therefore, you must take the appropriate approach to raise kids by treating them equally. Throughout the time of parenting, it is crucial to keep the focus on balancing, prioritizing, and quickly adjusting according to the requirements of your baby. Change according to requirement. According to Germans, with the development of 1 or 2 children, the challenges will change as well as your thinking will evolve, but you need to maintain a consistent, loving, and caring approach towards your kid. Teach your child to learn through different experiences and learn to tackle challenges. Anyhow, you need to remember that there is no particular right way to raise a child. All you need to do is to trust yourself and let the child enjoy your healthy company. They will stay on the right track. Conclusion. The World Health Organization is a powerful and influential organization that has played a crucial role in controlling different diseases during epidemics and pandemics. However, many critics still criticize it due to being slow and showing poorly coordinated responses. No matter how they work, the outcome has always been optimal. After dealing with a larger health crisis, they keep the focus on the betterment of elder or children's lives. They strive to serve a wide range of people for a livable world and prosperity. If you like this video, make sure to give it a thumbs up, and also subscribe to my channel for more informative videos like this one.